and I've been asked to talk to you about fasting in Ramadan with CKD, possible or impossible. I have no conflicts of interest. And I'd like to talk to you about reviewing the evidence around fasting and CKD, specifically chronic kidney disease stage 3 to 5, a little bit about dialysis, and a bit about transplantation. I had also the privilege to contribute to the chapter in the Dar Practical Guidelines launched last year and published this year in Diabetes Research and Clinical Practice. And this talk is based on this chapter that I contributed to. So I'd like to illustrate my talk with a few case studies. And the first one I'd like to illustrate with you is this 66-year-old gentleman who is a patient of mine. He's a Bangladeshi in origin. He's had type 2 diabetes for 20 years. He has CKD stage 3B with a GFR of 34. He has known ischemic heart disease. He's on insulin. He's on a number of tablets, including metformin and ACE inhibitors. He has moderate glucose control. He has an elevated creatinine. He says to me, he wants to fast. I have fasted every year for over 50 years and never missed a fast. What's the advice that you should give him? Well, this is obviously a concern. Someone like this does feel as if he's at high risk. What is it that we're worried about? Well, I suppose the main thing we're worried about during fasting is the risk of dehydration. Potentially, he could have a fall in blood pressure, reduced renal plasma flow. Will this predispose him to an acute kidney injury? Will he become dehydrated and then develop hyperviscosity, which will increase his risk of thrombosis, cardiovascular complications, stroke, etc.? So these are the things that we're worried about in this gentleman. But I would point out to you that there's no robust guidance on management of CKD specifically in patients planning to fast. And that's due to a lack of large-scale studies, and probably the most robust guidance is the Dar guidance that was published late last year. So a lack of studies in patients fasting with renal dysfunction. Most data involves that of small and uncontrolled studies. We do have a couple of systematic reviews and meta-analysis. So there's one amongst 140 subjects with CKD reported in the literature, which showed no severe adverse effects of fasting on renal function. And a meta-analysis of a further 6 studies showed that in patients with CKD who fasted over Ramadan, there was no difference in change of GFR before and after Ramadan, and stable patients with CKD appeared to be able to fast safely. So that's a couple of reassuring meta-analyses and systematic reviews. I'd like to share with you a little bit of data from East London, where I work. So this is data that we published in DRCP in 2018. During Ramadan 2018, this was a long fast of 18 hours in the part of summer in the UK. This was a prospective observational study of Muslims with type 2 diabetes and CKD in Tower Hamlets. All of the patients actually were counseled on the risk of fasting based on Dar Alliance criteria, and all patients were discouraged from fasting, but actually many of them decided they wanted to fast, and we offered them quite a lot of support and education, and we divided them into fasting and non-fasting groups and compared them. And we looked at them before fasting and at the end of fasting. We got all of our patients who were fasting to undertake education. They were given advice, particularly on increasing fluid intake and adjusting diabetes medication. So what we found, I apologize for this slide, it's very busy, but perhaps just looking at the things in red here, what you can see in the non-fasting group was that there was a slight improvement in glucose control, in the fasting group, and in the non-fasting group, no real change. But very, very importantly was that there was no change in GFR between the groups. So the fasting group and non-fasting group had no change in GFR over the period of fasting. So importantly, what we found was that there was no significant difference in change in GFR between the patients with diabetes and CKD who fasted compared to those who did not. None of our patients had hypoglycemia, acute kidney injury, or cardiovascular events. And so our survey suggested that despite advice, many Muslim patients did want to fast with CKD, and they appeared to be able to do so safely without any significant adverse events. So just to explain to you what happened with our gentleman, we firmly advised him not to fast. We explained the risk of fasting to him in terms of his diabetes and heart and kidney risk. We sought advice from our nephrology colleagues, but he insisted on fasting, and he did incredibly well. We stopped his metformin and ACE inhibitor because the risk of acute kidney injury. We advised him on lots of fluid, frequent testing. We reduced his insulin. He had regular phone contact with us and our diabetes nurse team. And he fasted successfully for 29 fasts, no hypoglycemia, good glucose control, some weight loss, and no change in his kidney function. So, I mean, he did incredibly well. And what I do find in my patients in East London who are keen on fasting is that they are very resilient. They actually do very well, especially if they're given a lot of guidance and education. They generally do very well. What about dialysis and transplantation during fasting? Can people with diabetes or CKD on dialysis or transplantation fast? Well, let's think about this woman, 56-year-old woman, type 2 diabetes for 15 years, end-stage renal failure on hemodialysis, on insulin, a pretty good glucose control. One of my friends fasted on dialysis last year. I want to try. This was what she said to me. What's the advice? Well, my advice generally, anyone on dialysis, is do not fast. There's no way you're going to be able to fast. It's just impossible to manage these fluid issues that you may have. But much to my surprise, a couple of years ago, we did a review on this topic and looked at the literature. And there is a little bit of literature and a couple of studies I'd just like to point out to you. There was Al-Wakil from Riyadh in 2009, a 14-hour fast, 31 patients on peritoneal dialysis. And what they managed to achieve was meticulous supervision, modification of patients' treatment, including some extra PD cycles at night, no morbidity or mortality. All patients were able to fast at least some days during Ramadan. And this was a prospective multi-center observational study of 635 patients on hemodialysis from 5 centers in Saudi. No difference in pre and post-dialysis blood pressure, potassium, albumin, or weight. No increase in mortality and morbidity or cardiovascular events. So overall published data suggests that actually if you're on dialysis, it appears relatively safe, no associated significant mortality or morbidity, some changes in electrolytes which need careful monitoring. Nevertheless, it's really very high risk. And I still feel my advice to all patients on dialysis is not to fast. You certainly shouldn't fast, but if you want to, then perhaps we can assist you in fasting and monitor things very carefully. What about this gentleman? So he's a 66-year-old gentleman. He's had diabetes for 20 years. He's had a renal transplant, and he's been very stable. So he's got a pretty good GFR of 44, been very stable over the last year. He's also on insulin, on metformin. We have now quite a few of our transplant patients on SGLT2 inhibitors, dapagliflozin, because of the excellent renal data that we have. And he's got reasonable glucose control. He wants to fast. What's the advice that we should offer this gentleman? Well, again, if you look into the literature, in patients with stable renal transplants, a number of studies suggest pretty good outcomes. And there is a systematic review of 463 patients, which suggested no change in immunosuppressive drug concentrations, no change in the biochemical parameters that we might see, so no change in GFR, no increase in organ rejection or deterioration in renal function were observed. So our recommendation is that these patients are at mild to moderate risk, but they have to have very close liaison with a transplant and diabetes team. These are patients that could become quite poorly unless carefully monitored. So monitoring them carefully and liaising carefully with the transplant team is absolutely mandatory. So fasting in patients with CKD, these are the recommendations that we published in the practical guidelines last year. All patients with diabetes and CKD should discuss their fasting intentions with their diabetes and renal teams at least 3 months prior to Ramadan. So that means right now, we should be dealing with these patients right now. We should be talking to them about their fasting intentions and thinking about what they plan to do and advising them whether they are high or low risk. CKD generally we feel is a high risk state for fasting, and patients with moderate to severe CKD should be generally discouraged from fasting, especially if they have other comorbidities such as cardiovascular disease. But that having been said, there's very little in the way of evidence that a theoretical risk of acute deterioration in renal function with CKD is not borne out in many studies, and there probably is an increased risk of hypoglycemia, so we need to adjust medication. Some people with stable CKD3 may be able to fast if they have careful monitoring, reduction in risk of hypoglycemia, and Ramadan-focused education. But what about CKD, more severe CKD? Well, I would certainly say to my patients with CKD stage 4 or 5, if they are pre-dialysis, that you must not fast. So if we are trying to reduce their risk of going on to dialysis, then those are patients that really must be discouraged from fasting, extremely high risk. Patients on dialysis, perhaps there is some scope for some fasting. It may not be every day, but careful monitoring, it may be feasible. And fasting amongst patients with stable renal transplants is probably feasible with close liaison with the renal team. So patients with diabetes and CKD who plan to fast should be encouraged to drink plenty of fluids during the non-fasting period, perhaps a measured amount. I'm recommending 2.5 to 3 litres over that non-fasting period. Very important to drink and keep hydrated. Perhaps think about getting them to measure their weight on a daily basis to assist in hydration status. Perhaps actually feasible, checking a urea and electrolytes and a creatinine in the middle of the fasting month to determine whether the fasting should continue, and avoid foods with a high potassium or phosphorus content. So to summarize, fasting in CKD can be challenging, but moderate, stable renal impairment, patients probably can fast with careful monitoring. More severe renal dysfunction, we should be advising strongly not to fast, aiming to preserve renal function and stay off dialysis. Patients on dialysis, it may be feasible and they need careful support, and transplants probably is feasible if they've got a stable transplant and they probably can fast. Thank you for your attention. Wishing you Ramadan Mubarak.